the restrictions under our current bans are medically unnecessary, and this just takes it to the next level.
What we're trying to do is to educate people about what's in this legislation. What you just heard is a very powerful panel of 6 people telling us why this bill is a disaster for North Carolina, why it is not a 12-week ban. It is a ban of many abortions altogether, and it's going to hurt the women of North Carolina. So we're here to inform the constituents, and also we hope that it will inform a lot of legislators who voted for this and really didn't understand how horrible this is. It can be technical, and sometimes legislators vote for things and recognize that legislation wasn't what they thought. I'm going to veto this legislation Saturday. We're going to make sure that people understand during this week what is in this legislation. And what we want them to do is to ask Republican legislators who have promised to protect women's reproductive freedom to keep those promises.
We just don't want to go backwards. I'm just begging, please, don't make North Carolina go backwards. An anomaly that was probably not compatible with life, that we weren't sure, and we were going to send her to a referring hospital
None of this makes any sense medically. As medical individuals, we get a great deal of training on how to study literature, keep up with the latest science, provide informed consent to our patients so that they can make the choice that is right for them. And the North Carolina legislature is stepping in and saying, no, we know better than you what you need in your life and what you should choose for your health care.
When I was 14, I had no clue that there was sex education. I grew up in a small North Carolina town. I was so desperate to stop this pregnancy, I went into my aunt's pool and
Intimate parts of their bodies that are being sent to the state without their consent. A patient cannot say, no, I don't want a picture of my uterus going to someone in the state in Raleigh. They cannot decline it. They've got to get child care. And now they've got to do all of that 2 or 3 times. Those are insurmountable, and if they can get past those, they might show up and still be too late.
I tend to think that there will be a person who has a conscience. I tend to think that there will be a person who wants to keep a promise. I tend to think there would be a person who would want to create a legacy of standing up for what is right and for saving lives and protecting women's reproductive freedom. There's still an opportunity for that, and now's the time to do it.